So how do we diagnose our clientele, and how are we going to find the right sort of treatment for you? Treatments tend to start from the beginning, from the phone call, understanding you and what your needs are. We may ask you simple questions. On the day you come in, we ask you to fill out a form. There'll be a series of questions that hopefully you can fill out. These forms are generally for everybody, so some questions are not going to be applicable to what you're coming in for. From that point, I tend to do a waiting room diagnosis. So I'll come in and see your posture, see your what we call the Shen, or the spirits, and see how you present yourself on the day. We'd come in and then ask you a series of questions, and the questions, we talk about the 16 questions. How your bowel functions, or for one, if you've got digestive issues, if you've got sleep issues, how is your sleep patterns like? Asking you, do you fall asleep easily? Do you wake up during the night, or both? What wakes you up as such? If you're coming in for pain, we'd do the muscle testing, and we'd do the range of motion tests to figure out what muscle or what area is being affected and why. From that point on, we may use other aspects, one of the 4 pillars that we use. So questioning is one, palpation being the other. We may do pulse diagnosis. So with pulse diagnosis, we, more than what Western medicine is sort of looking at, we're not looking at the beats per minute. We want to look at the characteristics of the pulse. We want to look at the different positions of the pulse. It gives us a lot of information about which organ or which channel or which aspects of the body that we need to address a little bit more for you. So pulse diagnosis is very important. So we may ask you to look at your tongue, the tongue being the root of all sort of digestive aspects, and having redness on the sides of the tongue, meaning one aspect, redness on the front, cracks, deviations, any sort of swelling. That gives us a lot to work with. It's a jigsaw piece in a bigger piece, but we need to put that slot into somewhere into your what we call pattern differentiation, or the issues in front of you at the time. Then we may even ask for more questions on your what's going in, so appetite, thirst, the types of flavors that you like, giving us more information about you as an individual before we put that to your condition, which would then turn it into how we're going to treat you today.